Morning, everyone. As I said, Chris Alderson here, operating from home base, obviously, at the moment, like I expect that most of you are as well. So, look, what I thought I'd do this morning is just sort of spend 30 minutes just explaining or covering what I know anyway around this. And I think you'll all agree that this is a really rapidly changing situation. So there's no such thing as a perfect world at the moment. We're working all imperfectly and we think things will change soon, but I can give you the best of what I know at the moment anyway, and hopefully that will all be of help to you. So look, I might just start off, I'll share my screen and talk to you about what kind of happened 3 to 4 weeks ago when we sort of first went into lockdown and we started looking around the world about how other countries were sort of dealing with this issue. So hopefully at the moment you can sort of see on your screen 3 boxes there which talk to the construction health and safety COVID-19 framework. So I'm just rolling back a little bit. Construction Health and Safety NZ, we're a charitable trust. We're the peak health and safety body that the construction industry set up around about 2 years ago. We used to be called the Construction Safety Council, but the business was transformed around about 2 years ago into a charitable trust. And we see ourselves really as helping not only the regulator but also industry work through and create a much healthier and safer environment. So Graham Burke from Specialist Trades is actually on the board of CHASNZ, and he represents specialist trades there. And we have a lot of other industry players that actually represent different parts of the sector. So the other component that I might just mention as well is the construction sector accord. So around about 6 months ago, government was approached around a whole lot of issues across the construction sector that generically we felt needed improvement. And up to 4 government ministers agreed to engage with the construction sector around a whole lot of issues that were sort of systemic within the industry, things like contracts, procurement, and health and safety was one of those issues. So there was a mechanism essentially set up for the construction industry to engage directly with government, and primarily MB, which became really useful around about 4 weeks ago when all this COVID-19 stuff started really kicking off in a lot more serious way. So we already had a mechanism to actually engage directly with government. So immediately the whole focus of the construction sector accord became around what does the construction industry look like and how are we going to help post lockdown. And one of those work streams was around what do the health and safety requirements look like for construction companies to operate outside of level 4. And I'm sure that most of you will be aware that New Zealand's taken a bit of a unique approach to this. So we are on an elimination strategy currently, which is a little bit different than the UK, a little bit different than Australia, where construction's continued, and pretty much different than most other parts of the world. So although we have been able to look at what's worked in other parts of the world, we've had to absolutely contextualise that for the New Zealand situation, which has been a little bit different. So what we decided to do around 4 weeks ago was take control of the situation and really try and demonstrate to government that the construction sector could operate safely under level 3 and level 2, and this was how we were going to do it as a collective industry. So the government was very keen, obviously, to make sure that we continue the good work that everybody's been doing in New Zealand around the last 4 weeks in terms of actually getting our virus management down to where it is today, and they certainly don't want to see us going backwards. So they put on some pretty stringent requirements for businesses about how they can, how they want to see businesses operate post alert level 4. So that was the idea. So what we basically did was we built what we're calling a standard, and on your screen at the moment you can see that standard. This is available on the CHASNZ website, which I'll also just take you through in a few minutes. But this diagram here really explains the framework as a whole. So the standard is a Word document which government and MB and WorkSafe have all endorsed, which is a statement of what construction-related operations need to achieve to operate safely under level 2 and 3. So it's a document which describes the what do you need to achieve, and it talks about the high-level principles and the requirements right across the construction industry, whether you're civil, horizontal, or residential or vertical. So it is the sort of go-to place whenever there's a little bit of debate or a little bit of interpretation needed. Go back to that document and see what we need to achieve, because we do understand that how organisations and how businesses will achieve the requirements of the standard will differ depending on their workplace. It isn't an ASN standard, so if anybody knows about the Australia-New Zealand standards process, it takes about 6 months to a year to get a standard through. We obviously didn't have that amount of time to do that. So it is recognised though as an industry standard, and it's recognised and endorsed by WorkSafe as what they will look at when going to a work site as a test of reasonable practicability, what you should be doing. And I have been told by WorkSafe this morning that their intent is to randomly audit sites to the best of their capability to actually support the government's position on this. And as you know, under the Health and Safety at Work Act 2015, they've got various statutory powers, and all those statutory powers apply when they're interpreting this document. So we don't expect that the standard's going to change much. We think it's at most times it refers back to Ministry of Health guidance, and as that guidance changes, the standard stays the same. But we also realise that underneath that, there's got to be a set of protocols which are more in the guidance type area that probably will change. So the protocols are the how. So how you achieve the how you'd like to organise your business to achieve the standard. There's 2 protocols that are available on the CHASNZ website. There's the vertical and horizontal construction protocols. I guess you could think about them as the big end of town, about how larger sites and larger businesses will be organising themselves, or what the expectations are about how they'll achieve the standard in a consistent way. And then there's another protocol in there, which is a much cut down version for residential sites, because I'm sure you'll all realise that although the principles might remain the same, the actual methods for how you do this kind of stuff could and will vary depending on the size of the business and the nature of that business. The third layer, business and site plans. It's really important that all construction businesses plan their own way through this, and actually they do have a plan. So a lot of their standard and the protocols talks about the need for planning and to actually have a specific COVID-19 plan for your business, for your operation, and down to the site level, because that's what WorkSafe would look like. If they're going to see a site, they want to know how you're actually applying the standard and the protocols on your site on a day-to-day basis. And it's really important as well that when you're building those plans, which can be quite simple plans, you know, it can be a one-pager, they're taking into consideration all the things mentioned in the protocols, and there's some good guidelines and there's some good templates in there. But at the end of the day, it's also really important that they're communicated well with all your workers, and add some feedback from the workers about how these are going to work as well. And that's part of our part of the nature of our Act in New Zealand. So again, just recapping, we have a standard which has been negotiated and I guess endorsed. It has been endorsed by WorkSafe and MB. From an operating point of view, we have 2 sets of protocols, residential as well as horizontal and vertical construction protocols available on the website, and below that we're expecting organisations to have their own business and site plans that better reflect their own circumstances but still achieve the standard at the end of the day. So those are the 3 layers. I might just quickly flick to, I'll just stop sharing for a second there and bring up the CHASNZ website to show you where all this is available. So I'll share screen again. Hopefully you can all see a picture, a nice green picture at the top there with the yellow branding for the Unite Against COVID-19. So this is the Construction Health and Safety New Zealand website, so chasnz.org/COVID-19. This website is the COVID-19 page, so it's a landing place, and what we thought we'd do is try and keep everything as much as possible in the same place. And as documents update, and in particular the protocols are very likely to update. So the protocols themselves are working documents. They're built with the best knowledge that we have at the moment, and they're, but of course, you know, as we're dealing with this virus at the moment, it's kind of changing on a weekly basis. We also haven't had any feedback for how this will work in the field, and through master electricians, Site Safe, master builders, certified builders, a lot of other organisations, civil contractors New Zealand. We expect to get some feedback in through the members to say, actually, that bit's not working so well, but maybe, but this bit is, so we'll be able to actually adjust the protocols. So again, the protocols will change probably on a semi-regular basis. But if you keep coming back to the website, you'll always have the most current version. So you'll see there's a download there for the standard, and that's not expected to change much. And then there's a download for vertical and horizontal protocols, or the big end of town, and then the residential construction protocols are more nuanced, simpler document for small businesses, in particular in residential. We've also got an area here for tools and resources, and as we're finding, there's been a lot of people across the industry working on some really good stuff, and you know, tools, templates, posters. When we find that stuff, and we're very keen for people to send that stuff through to us, because it's one thing we can do as an industry is share it, and we're actually putting a lot of those tools and resources into this part of the website as well. So look, one-stop shop. I would say at the moment we're expecting potentially another protocol to come in later in the week, and that's to do with mental health. So we know that the mental health of our workers is very important as well, and the Mates in Construction guys have been working on some guidelines, particularly for businesses who aren't used to talking to their staff about mental health, about what they can do, and some really simple stuff, some cheat sheets around that as well. So be aware that there'll probably be some more tools and resources to do with mental health coming in over the next couple of days as well, which is all good stuff. So that's where it all is, and that's where we'll continue to put the stuff. So what I thought I might do now is just take everybody through the protocols, and I'll start at the horizontal and vertical protocols. And you'll see, and I might just delve into a couple of areas that have been a little bit more controversial, and typically some of the questions that we've had so far. I'll just touch on those and sort of explain where we are on that at the moment. So again, let's share screen, and hopefully you'll see a nice blue coloured document that's come up. And that is, I might just make it a little bit bigger. No, maybe not that big, maybe that big. Here we go there. So I'd first like to say that the team that worked on this document, it wasn't CHASNZ, so we very much endorse this document, but it's been really strongly led by Site Safe, by master builders, by civil contractors in New Zealand, by vertical leaders groups. And what they've done is they've gone out and they've worked with a whole lot of people in industry who have real operations to test how this stuff might work. So I'd just like to thank those teams from those organisations and the businesses that have contributed to this. It's been really good. These businesses have been sort of worried about their own business, but they have spent the time to actually document and work through some stuff they think will be helpful for the rest of industry as well. So that's really important. So I'll just go to this page here, which is really just the summary page, and I might just hover on here for a moment. So right through the standard and both sets of protocols, we have a very, very simple framework for organisations to work for. And essentially it's 4 different stages of construction. And then what do you do if it all goes wrong? So some advice in terms of emergency management, in particular around COVID-19. So the standard is structured the same way, and the residential protocol is also structured in a very similar way. So I might just go through this in a little bit more detail, because I think that might be quite helpful. So the first part of it is around before arriving on site. So one of the things we are a little bit worried about is a lot of sites have been on furlough for the last 3 to 4 weeks, which is a lot longer than we'd typically spend over, say, the Christmas break. And in particular, a lot of sites are actually down tools pretty fast, and probably not in a way that you usually would in a normal business environment. So it's really important, and this is included in the standard and in the detail, that before you start work again, we'd like you to have a plan for how you're actually going to deal with COVID-19, rather than just charging everyone back on site and then inventing it for you on the fly. So we do have a little bit of time. We have a few days to do this. This document's been out since the weekend. So we do want everybody to think about planning at the moment. And when WorkSafe look at different organisations and about what they're doing, probably the first thing they'll ask is, where's your plan? So, you know, what are you doing? How have you planned this sort of stuff? So I think that's probably the most important component to start off with. That plan should also include things like, is your site still fit for purpose? Given the fact that it's just had 3 to 4 weeks sitting there, do people still know what they're doing? Is the equipment all up to scratch? Is your scaffolding still in spec? So have a look around and make sure that includes things like that, because what you don't want to do is introduce a whole lot of other risks, have a whole lot of other accidents in your first week that could have been avoided with just a little bit more thought. And in particular, if you're actually visiting those sites and you're in the trades, it's very normal to actually expect to see their plan or have a conversation about what kind of planning they should have been doing as part of our intra-PCBU requirements. So look, inductions, obviously, the less face-to-face stuff at the moment, the better. So I think sites will be either doing it by phone, which is fine, having a conversation. Look, we've all got good at using Zoom over the last couple of weeks, better than we ever thought we would. So I think there's a lot of possibilities there. We need to talk to people about the fact that, hey, it is safe to go back to work because we have got this plan. We have seen in a lot of other industries who have been working through level 4 a large amounts of absenteeism because people just aren't confident about coming back to work and they're scared. So I think there is a job there to make sure that everybody understands that you have got things under control and it is you are coming back to a safe environment. Typically, you'll have people a little bit conflicted, or some people conflicted around the fact that they need to earn money versus the fact that are they putting themselves or their family at risk as well. So that's quite an understandable tension that we should all reflect on. So again, having that plan and that engagement before they come back to sites is really important. I think you also need to understand about the health of the workers, because there are vulnerable people out there. And you need to understand what that picture looks like. So the Ministry of Health website talks about vulnerable people and what the conditions for that are. And don't forget as well that if they live with a vulnerable person, so they might not be the vulnerable person themselves, but if they live with a vulnerable person, they are also a vulnerable person. And that advice has changed over the last couple of weeks. It also includes people, for example, with a BMI above 40. So you need to actually understand the underlying health of your people as well, to confirm they're safe to be on site. And as well, you know, we need to understand, you know, whether they've had any interaction around COVID-19. Look, the government's done a really good job, and New Zealand as a whole has done a really good job about getting this thing under control as much as we can, but it's still out there, and we know it's still out there, so we need to take it seriously. You need to think about how workers will travel to site and plan for that. So having some guy drive around 5 of his mates and all get in the same car closely together and turn up on site is probably not a good idea. So having a conversation about just how they'll all get to site as well is a good idea. And if there is any additional PPE required, they need to understand that as well. Now, I'll just touch on this for a moment around PPE, because this has been a really controversial area. What we haven't done in the standards is require people to wear face masks and gloves. And that's for some really good reasons. One is World Health Organization and Ministry of Health don't actually recommend that for construction type work. The reasons are that they're only really effective when you've got high community transmission. So in places where you've seen overseas, where you've got in Asia or in Europe or in America now, where there's a high likelihood that there's a lot of community transmission. They've got a lot of public transport going on. That's not the situation in New Zealand. We've got very low levels of community transmission, and they only really stop people spreading it. They don't stop you getting it. And that's evidenced by the fact that even with really great training, with great PPE, even health workers can become infected by COVID-19. So the advice at the moment is just normal PPE. Of course, you'll have some people who might want to wear a mask, and that's fine. But the other thing we don't want to do is create a whole lot of pull around critical PPE that we need to prioritise for the health service at the moment, for no real good advantage for the construction sector. So that's the reasoning there. So think very carefully about PPE. Our advice is around masks and gloves, unless they're gloves that you normally wear, is don't wear them. Site entry is the next bit, and this probably the biggest thing here is around track and trace. So we do need to understand who's coming to sites, and for remote businesses who are going to, say, residential places or other businesses, you need to know where your people are and where they're going and where they've been, because if we do have another strike with COVID-19, the government's going to require us to do a lot of contact tracing. So get ready for that. There's some manual ways of doing it. We've got some registers included in the protocols, and there's probably some apps coming out. So keep an eye on the CHASNZ resources page. We're going to put some apps up that we're sort of becoming, I think might make things easier. The ConstructSafe app, for example, at the moment, it's a free app, and that does it. So that's got geofencing on it. If you don't want to go down that path and have to re-educate everybody on apps, then hey, look, as long as you're not transferring pieces of paper and pens between each other, so it's contactless, then a manual register is fine. So the other thing is, you need to actually remind people as they're coming onto site what the protocols are on site, and that hygiene probably is the number one control, which is that sort of hand washing and that regular making sure that people are doing what they can to actually sort of physically distance themselves while they're on site. So that comes into site operations. Physical distancing has been a little bit of a controversial area over the last couple of days. So you're probably aware on Thursday when the Prime Minister announced that 1 metre was okay at work. That's a big jump from 2 metres, which we've all been told over the last 4 weeks is the minimum. So the World Health Organization has also recently recommended 1 metre. Now, the idea behind this, frankly, is that 2 metres in an uncontrolled space, like in public, in a supermarket, as we're walking around, is appropriate because it's very hard to contact trace in that environment. However, at work or in education, very much easier to contact trace. So if you are going down to 1 metre, our advice is that, look, there needs to be a strong message there for your employees. 2 metres is preferable always. We do realise in some construction businesses that's absolutely impossible, but the advice here is, if you are in those circumstances, apply your hierarchy of controls. So think about, if you can't eliminate the work or you can't delay it to some other time, if you actually absolutely have to get guys working in close physical contact, then try and limit as much as possible, and then that might be a good place if you actually have got some PPE like a mask to actually put it on, because it might just stop someone who's symptomatic spreading it to somebody else. But at the end of the day, good hygiene practices as well. We've checked all these protocols with the University of Auckland School of Public Health, and their overriding control in all this is absolutely hygiene, hygiene, hygiene. It's our best preventative measure. Much better than, for example, if you're trying to temperature check people at the gate. That's actually not foolproof either, so we're not recommending that. And if you are temperature checking, some people are asymptomatic before they have a temperature, and you might actually let down or drop your guard around hygiene because you think you're okay. Hygiene is our #1 control on all this. So cleaning down your site, making sure that their personal hygiene is really good, making sure that whenever possible we can have physical distancing are the key things. So we talk about leaving site. We need to know, obviously, we need to register people out again, whether they're going to another site or whether they're going home. We need to actually provide workers with some good advice about what they do when they get home. So there's a really good protocol on the CHASNZ website under the tools that show you how you sort of decontaminate yourself every day, and we'd like workers to be up with that, because some of them will be worried about whether they've got vulnerable people at home or not. They'll be worried about that, and it's pretty simple stuff. It's all totally doable, and hey, all our supermarket workers have been doing it for the last month. So we know that there's examples there as well. On the management protocols here, this is around, what do you do, if you do find there's an issue on site, and this is where it gets really directive, because, we fall under the Ministry of Health requirements here, and we haven't got many options. We've got to actually notify them, we've got to get them involved, we've got to let the experts take over and direct us around what we do with our sites and how we communicate with our workers to achieve that kind of contact tracing. So look, that's everything that's in the protocols. I'll just quickly change here. Hopefully now at the moment you can see the residential ones. They're slightly different formatted. Again, we've had them worked on by a great team and some real leadership from the likes of Jenny and Milestone and small builders, big builders, Fletcher Residential. And as we go through, it sort of follows the same process, but it's a lot probably simpler than the other document. My advice is to have a look at both documents, and there's great stuff in both documents, and work out a plan from your own perspective, and use these documents to actually achieve what you need to achieve. So look, those are some of the big issues that we've sort of had. The 2 metre versus 1 metre rule, very topical at the moment. Again, common sense, 2 metres wherever possible. If you have to go down to 1 metres, make sure you know who's doing that, really track them, and apply your normal sort of hierarchy of controls in there. If you've got 2 people in a cherry picker, make sure that they're at each end of it. If you've got to get them together, try and limit that sort of work. Masks and PPE, look, really what we're advising is that for normal operations, it's just normal PPE. Tracking, really, really important, and hygiene, ultimately very, very important. So those are the key messages. More than happy to sort of work through if there are any questions or anything for the last sort of 10 minutes. I'll try and answer them as best I can, but it's a moving feast. I would just say though, from an industry point of view, we're actually quite well placed compared to other industries at the moment. So when I talked to primary industries who operated under level 4, they had to throw their protocols together very quickly. They said it was very difficult, and a lot of businesses came back straight away and said they couldn't do them. They were then told that you have to do them or you're not going to be operating. And then of course they found ways of doing them. So the example we heard about was a pack house, a kiwi fruit pack house with 500 people in it, all standing, in close contact. And within 2 days, that actually had some engineering solutions in there that actually created sort of barriers for people to be able to allow them to work. So there will be a bit of pain at the beginning as we get used to this. We understand that. but it's part of our license to operate. We will innovate, and we expect us all to be innovative around this, and we will get better at it. And then hopefully, if we do it really well, we'll quickly descend down through level 3, level 2, and back to normality as soon as possible. So that's the overall objective, so we can all get on with our lives. I've got some questions coming up. What are your specific recommendations around working in customers' homes when they are present? Yep, that's a good question. So what we're going to do is we'll put up, if it's not there already, we've got a little decision tree that we picked up from the UK. So I think, again, it's, you're going into their bubble and you need to, I guess, for a start, communicate your working practices with those clients before you get in there. You need to understand what their history is. Like, are they in lockdown for some reason themselves? Have they tested, or are they in the process of testing for COVID-19? Have they got any symptoms? So you definitely need to understand that. And then there's got to be some sort of physical separation and some sort of hygiene that comes in as well. A lot of trades like plumbers or etc. are already pretty good at disease prevention and have some sort of skills there. But what we'll do is make sure that there's a little decision table there to say, hey, look, there's some things that are probably okay to do with the right controls in place. But if you did come across, a residential site where you had to go in there and you knew people or being asked to go in there and people were symptomatic or were under testing, my advice would be don't. And particularly, contact Ministry of Health or master plumbers or master electricians or whatever organisation that you're part of. Ask for a bit more advice on that. Don't just charge in on there and assume that you can manage through this.
Chris, we do actually have a couple of questions coming through about travelling. So if you have multiple people that are travelling to a site, what would your recommendations be around that, or what would the protocol say around that?
Yeah, so this is where the 1 metre versus 2 metre thing becomes quite important. So I do know that, within a larger car, you can have 2 people in the larger car, one in the front right, one in the back left, and still achieve sort of 2 metres. We do know that, with minivans and buses, what we don't want is, 4 guys in a Toyota Corolla, all crammed in there together, driving from, North Shore to Manurewa on a daily basis and picking up 4 different households. So again, it's a matter of being sort of pragmatic around this. 1 metre is allowed, but you need to be, you need to have your hygiene. You need to have, you need to be basically, trying to protect those workers as much as possible during that and limiting it for wherever possible. So my guidance would be, first of all, where you can maintain, adequate separation. So if you go on a public bus at the moment through Auckland Transport or any of the bus companies, they've got protocols around you can't sit next to someone. And I think those are pretty good protocols to follow. We're just trying to avoid that sort of close contact, particularly during level 3. It's going to be challenging, but we just need to work our way through it.
Yes, and I think we'll all be trying to work out how we get the new normal, as it will change again. What about on sites where there is a potential need to share tools? What kind of recommendations would there be around that?
So I think in the protocols there are some recommendations around cleaning those tools. This is where sometimes, but I guess you got to watch yourself around electric tools, of course, and just not dump them in, soap and water, but being able to sanitize them with wipes, that sort of thing. If you are sharing tools, I think it's an absolutely good protocol at the moment, because what you don't want is, those droplets or potential for, COVID virus to actually be spread through common places where people touch. So another question I had the other day was, what about scaffolding? Do I have to wash all my scaffolding down? No, just the bits where people commonly grab rails and would commonly actually, haul themselves up, that sort of thing. So again, it's just being pragmatic. And think about it, if it was your family on site, what you'd be doing to protect themselves from potentially transferring the virus. I mean, we've all got to be coming into this with the mentality that it actually still is in our society somewhere, it's just lurking, and we definitely don't want to create new work clusters or show the government that, you know, because of our poor hygiene and poor practices, that the construction industry or any other industry is a source of reinfection, because that will push us back to 4 pretty fast.
Last question for today. All other questions that if we haven't answered, we will get a document together with answers for those. But the last question that we're going to look at today is around using temp agencies. If companies are using temps, is there any recommendation around that, especially around requesting medical clearance?
So again, I think that, you know, pragmatic thing, and medical clearance can take time, and medical clearance is only as good as when the actual medical person saw the person being looked at. And as you know, you can reinfect or pick this thing up, you know, the day after or the day after that. So I wouldn't over rely on medical clearance certificates. I would be using questionnaires for the staff, basically talking to them, saying, you know, have you come into contact or are you feeling any of these symptoms? There's some really good stuff in the protocols about what to ask. There's actually a really good table in the protocols for how to do that as well. So I'd just be a little bit weary of just over relying on a medical clearance certificate, because this thing can change so fast.
Thank you so much, Chris. So the protocols are available on the CHASNZ website, which is CHASNZ.org, and you'll be able to find all of those there. This recording will be made available to both CHASNZ and our partner in today's webinar, Specialist Trade Contractors Federation. So it will be put up, links to the recording will be put up in multiple places, as well as on the Master Electrician's website. Thank you again, Chris, for your time. It has been very enlightening, and we will wait with bated breath for the announcement this afternoon at 4 p.m. from the Prime Minister to see what our next step is.
Yep, thank you, everybody.